in the debate, when Romney mentioned that we have the best healthcare system in the world, so why would we change it the way we are?
Right.
I noticed on Twitter, Bill Maher mentioned that the UN ranks our healthcare system like 37th in the world.
Right.
Number one, is that true? And number two, what are your comments on that?
Well, of course, anything coming out of the mouth of Bill Maher is by default false. But secondly, if you're relying on the UN statistics rate how many people have to pay for it. So the UN doesn't think people should pay for health care. The UN doesn't think people should pay for transit. The UN doesn't think people should pay for shelter. And if Bill Maher wants to help people pay, he ought to, instead donating $1 million to Priorities USA, he ought to be donating to somebody who needs health care. He doesn't do that. All he does is run his mouth on a show nobody watches. I don't have a lot of time for people like Bill Maher. But the larger point here is, if you think health care ought to be free, then the UN rankings is something you look at. But nothing's free. Somebody's going to pay. And so if you're not paying the doctor, you're paying taxes so the doctor can get lower reimbursements and so you can wait in line to see him. But you're still paying. Somebody's going to pay. There's no such thing as a free lunch. What people like Bill Maher never tell other people is, we have, prior to the Affordable Care Act, we had 30 million uninsured. First of all, it was 46 million, according to Mr. Maher and the president, until they realized, whoops, we got a lot of illegal immigrants in there. Okay, let's bring it down to 30 million, because that was embarrassing, saying they wanted to cover illegal immigrants and the uninsured. So then they said, well, 30 million uninsured, but we're going to cover those people. What they never tell you is, we set a record last year for the number of people who had insurance. I believe the figure was 260 million, but I may be off on that. But it was a record. So they never tell you that the good side. Look, the bottom line is this when it comes to health insurance. The socialists out there, like Mr. Maher and some in the administration, will tell you that the free market healthcare system doesn't work. Here's a news flash. We haven't had a free market in healthcare since 1945. In 1945, when we had wage and price controls at the height of the war, effectively what the government said, because they wanted to devote resources to the war effort in the 40s, they said, employers can't offer you more money, and you can't raise prices. So what did employers do at that time? They said, well, we can't pay you more because of wage and price controls, but we'll give you insurance. That wasn't considered a wage. So they gave free insurance. After the war, that continued, and then we changed the tax code, which is not exactly free market. Taxes by definition are intervention in the free market. We changed the tax code to say, okay, employers can deduct what they give employees for health insurance, and by the way, employees who get the health insurance don't have to pay taxes on it, even though it's income. That is not free market health care. Then you had all of the mandates, some 2,000 to 3,000 that states have put on it. You now have the mother of all mandates with Obamacare, none of which, by my definition, has anything to do with a free market. So right now, if I want to buy a cafeteria-style health care plan, again, going back to that 25-year-old who's been priced out of the market due to government intervention, and I just want coverage for the big stuff. I'm healthy. I don't go to the doctor but once every 3 years. I might go for an annual physical, but I might not if you were like me when you were 25. I can't buy it. I can't buy just a policy that we used to call major medical. It is illegal. I can't find it. I can't buy across state lines. I've got to buy a Cadillac policy that the compassionate left has loaded up and priced me out of the market. That's why people don't have insurance. That's why young people don't have insurance. Why on earth would I pay $15,000 a year when I'm consuming $1,000 a year in health insurance? It doesn't make sense. If you could lower the cost of insurance for young people, they'd buy it if it were $190 a month. So this has nothing to do with the free market. It has nothing to do with the system, the American system that's failed. It is a failure of government intervention. You know, liberals are really adept at this. What they do is they intervene in the free market, whether it's education, whether it's energy, whether it's healthcare, just enough to screw it up, and then they blame the free market. And that's exactly what's happened here. And so, you know, if you've spent a minute listening to Bill Maher, you've just wasted a minute.